Kings and queens have crowns, and although you're not royalty, you may need a crown too.
The crowns I'm talking about aren't on your head, but on your teeth. The airmen that make these teeth toppers are hidden away in their laboratory at Yokota's dental clinic.
Well, we're basically here to make we make dentures, crowns, and bridges for dentists and for their patients.
You might need a crown to cover a discolored tooth, protect your tooth from breaking, or restore a broken one. Most military installations have a dental lab on site, unlike many civilian dental practices.
Usually in the civilian world, labs are kind of their own entity. One of the benefits of being in the military is that we have in-house labs usually. It gives us a lot more flexibility with the restoration because we have the lab in-house.
But what exactly is a crown, and how do you go about making one?
Crown is like a cap that goes over top of the tooth. When we identify that a patient needs a crown, we basically cut the tooth down, and then after that, we take a mold. We send that mold up to the lab. The lab pours it into stone. They give it to us to trim, and then from there, the lab basically takes whatever we give them and fabricate the crown.
It can take weeks for a technician to make a perfect crown, but there are some perks to the labor-intensive task.
I get to be more creative, use my hands a lot. It's a lot of hands-on, and you know, if you're creative or you're good with art, it's no problem.
So the next time you find yourself at the dentist in need of a crown, it's quite possible you'll find yourself being treated like royalty. Petty Officer Stephen Jackson, Yokota Air Base, Japan.